Welcome to Roadie Wellness, where we explore all things health and self-care. Whether you're seeking mental clarity, physical fitness, or insight from students like you, we've got you covered. Hi, welcome back to the Roadie Wellness podcast. I'm Olivia, and I'm here with Jessica Greene today. She is the Assistant Director of Health Promotions and Wellness. And today we're going to be talking about vaping and the free nicotine replacement therapy that Health Services offers. Thank you for joining us today.
Thank you for having me. I'm so happy to be on here. A little bit about our office. We are located at Health Services. We're on the lower level in health promotion. There's a couple other offices down there like VPAS, Nutrition with Kelly Kidd, and the Alcohol and Other Drug Educator, Ariel Sherman. And so some of the things that we do are just promote health and wellness and healthy lifestyles to our students, like how to get enough sleep, reduce stress, and how to have good communication, and also how to quit nicotine and using devices like vaping and Zins and smoking.
Thank you. Yeah, you guys do a lot down there to support the students and support wellness, so we all appreciate it a lot on behalf of students, myself. I want to start off just talking about nicotine trends, what you've seen at URI, and just trends in general among college students. Do you have any statistics that you'd like to share with us today?
Yeah, so we know that middle schoolers are still using e-cigarettes. It starts that early. We have about 3.5% of middle schoolers reported in 2024 through the Truth campaign who are using e-cigarettes. That was jumping up to about 7.8% of high schoolers. And by the time they get to college, about a quarter of college students have used or are using e-cigarettes. So we're seeing similar trends here at URI. So students are coming in having experience. There's some students who do use for the first time while they get here, but the majority of our students have used in high school and are bringing that to campus with them.
I actually, in preparation for the podcast, wanted to see how many students were interested in quitting as well. Doing the previous podcast where I talked with some students about their experience quitting, one of the guests mentioned that she wanted to quit vaping, but she felt like no one else around her wanted to quit vaping. And when she kind of told her friends that she was going to quit, all of her friends wanted to quit. And so I was like, I wonder how many students actually want to quit. And maybe people just don't realize how many peers out there are interested just like them. So from the Truth Initiative survey from 2023, about 67% of 15 to 24-year-olds that use e-cigarettes said that they wanted to quit and actually used it as their New Year's resolution. So I thought that was pretty interesting. That's like more than half.
That is amazing. Yeah. And we actually find that as well. So when students come into health services every 6 months, they're surveyed when they check in for their appointment to ask about their nicotine use. And of those who report that they use nicotine, we ask if they're interested in quitting. And about 5 to 10 people per week actually do report that they're interested in quitting and want to learn more about our services.
Yeah, 5 to 10. That's a good chunk of people.
Yep.
So.
And a lot of times what we do is we give out information, especially at our wellness tables, about how to quit. And we put together these quit nicotine packets, and we encourage people to give them to friends, people that they know who might be interested in quitting. You can also get them in our wellness vending machine at the library as well.
So before talking about the resources, I'd love to go over why people should quit nicotine. So can you share with us some facts about nicotine and vaping and how it affects a person's life and how harmful it can be, and having people understand how detrimental the effects of nicotine is important for people to understand.
Yeah, it's so wild to think that vaping was created as a form of smoking cessation to help people who were using traditional cigarettes try and quit using tobacco. And now we have a whole new audience of people who are addicted to vaping and having a hard time quitting. Some are actually trying to go back to traditional cigarettes to quit vaping, which is ironic. But the item in vaping is nicotine, and that is what is highly addictive. And we know that a lot of times students don't realize how much nicotine is in their devices. For instance, a 2,500 puff count device, which is on the lower end, is equal to about 8 packs of cigarettes. And so we find when students are coming in and meeting with us that their nicotine use is about as high as a pack or a pack and a half of cigarettes a day. And when you put it in terms of cigarettes versus the vaping device, it's very eye-opening. You don't realize how much nicotine is in your system. And nicotine is a highly addictive substance. It does have negative effects on the body. It's very addictive. It increases your blood pressure and heart rate. It increases your risk for heart disease, stroke, and blood clots. It does produce withdrawal symptoms. So if you have a high dosage and you're trying to quit cold turkey or quit without a nicotine replacement therapy, you can end up with cravings, irritability, withdrawal symptoms, anxiety. Using high doses of nicotine can increase your risk for things like seizures. So we do know that nicotine, being a highly addictive substance, has a lot of negative health effects, and that it's really hard to quit if you're not getting help and if you're not using some type of nicotine replacement therapy if you have high doses.
Yeah, I'm glad that you mentioned a lot of the nicotine-specific effects, because I know Zins are becoming super popular and that has no smoking. So nothing's going into your lungs. So I think a lot of people think it's healthier because it's just that like nicotine packet almost. But nicotine itself is still causing health effects and is still not good for a person's health and wellness. So glad that you mentioned that. I know some people don't use nicotine products consistently, like every day, but it is popular in a social setting. Is that still harmful, and what is your opinion on that?
Yeah, so if you are not a regular nicotine user and use occasionally, there is always that risk that it will increase because of the addictive nature of the nicotine products. So if you came to campus, you've never vaped, but you're out with friends on the weekends and you're, borrowing other people's vapes and trying it out, there is a high chance that you will eventually crave that vape when you're not using on the weekends, and you might purchase one yourself. And then it's definitely the nicotine that's addictive, but it's also habitual. So using a vaping device, that hand-to-mouth oral addiction is very hard for people when they're trying to quit. And so it just becomes second nature. When people vape, they don't even realize when they're doing it all the time that how often they do it. Actually, it's one of the first steps when we do have people come in and help them try and quit. We actually have them keep a log of how often they're vaping, and they're quite surprised at the frequency. And so, so it's the habitual nature of it, the nicotine that's highly addictive, and that hand-to-mouth habit that is really hard to break.
Also, I wanted to mention, which I think is really interesting, that the brain continues to develop till the age of 25. And so a lot of cognitive function, memory, learning,
impulse control.
Yeah, impulse control, all of that is still developing. And so nicotine can stunt that development.
Yeah.
And as college students trying to pursue learning, all of us, the majority, are under the age of 25. These nicotine products are not good for our brain's health and not good for our future in a professional setting as well. And
it's ironic because I hear students all the time saying that they're using their vape when they're studying as a way to help them study, but what they don't realize is that the vape is actually not helping in the long run, and that addictive nature that causes them to crave that vape when they're stressed out is actually hurting their ability to relax and decompress and be able to calmly handle their studies. And so we do find that when students are quitting during times of stress, like studying or during midterms or finals, those are really difficult times for students to want to quit, because they think that their vaping device is their coping technique and their ability to get through that difficult time. And so what we do in nicotine cessation here at Health Services is we teach them different coping techniques that they can use and that are actually better for them. And once they have the nicotine out of their system and they've learned those new coping techniques, they actually are better able to handle that stress. So that vape that you once thought you needed to have when you were trying to study, you no longer need it, and in fact you're doing better without it. But it does take a little bit of time and work to get there.
Yeah, and going off of that, not just the coping and cognitive function, a lot of people use it for anxiety as well, which is ironic, again, like you were saying, because nicotine it causes anxiety.
Well, it doesn't cause anxiety, but it causes it to exasperate. So if you are already anxious and you're using nicotine, especially higher doses, it can exasperate that anxiety. And so getting nicotine out of your system and quitting and using healthy coping techniques like physical activity, meditation, yoga, deep breathing, those will all help you reduce your anxiety. Mm-hmm. But yeah, people think that the coping technique is the nicotine, the vape device, but it's actually making things worse.
Yeah, that's actually a great tie-in to the next question I wanted to ask. What are some benefits of quitting that maybe unexpected or that people can look forward to, like, on their quitting journey?
Absolutely. So particularly for our vapors, our students are young and healthy and usually pretty athletic, and they're always surprised that they are starting to get winded and they're starting to lose stamina during physical activity. And that's one of the first things they say, I want my health back. I want to be more physically active and not get winded, and being able to be more physically active. And so their physical health is really important to them. I also think that their mental health does and will improve when they're quitting. It helps, give them more energy. Food tastes better. Nicotine is an appetite repressant. And so when you're off of nicotine, you find that your taste buds have improved and that you crave and want foods. So you're better able to taste those foods better. And obviously, it helps stabilize your mood when you're nicotine free, and improves your overall mental health and well-being, and it saves money. And, these vaping devices are expensive, and so there's a cost factor as well when you quit.
Yes, yeah. I know that was one of the motivating factors, actually, for one of the students that I interviewed on her quitting journey, and, we're all college students and probably broke, so that's beneficial.
Absolutely.
Yeah. And getting a lot of energy and stamina back is also going to be beneficial, because no one wants to be huffing and puffing going up the hill out here. So, yeah.
That's one of the things when we talk to students about quitting, one of the barriers is always the boredom, how to fight boredom and how to do other things during times of stress. And so we go over those behavioral techniques in our sessions. And one of the things I always encourage students is to be physically active and be outside. If you're sitting in your room for hours at a time, staring at a wall, you're going to crave that vape. But if you get outside, get some fresh air, ask a friend to go for a walk or take a hike or something like that, you're improving your mental health and well-being, you're physically exhausting your body, and you're not going to have those cravings like you might if you were just sitting in your room.
Yes. Nicotine replacement therapy can also help with the process of quitting. Do you mind talking a little bit about that and why students should go to health services for that?
Yeah, definitely. Yeah. So what we're finding is students who are vaping every day, multiple times a day, usually are vaping enough that the amount of nicotine in their body equals that of a pack or even a pack and a half of cigarettes. That's how much nicotine is in their body daily. And so trying to quit cold turkey or quit without any type of nicotine replacement therapy can be really challenging. You can do it, but it can be really, really hard, and you're going to have those withdrawal symptoms, being irritable, restless, difficulty concentrating, moody, things like that. And so nicotine replacement therapy, like the patch, the gum, or the lozenge, and even the pill that we can have prescribed for you, those are available at URI Health Services. The patch, the gum, and the lozenge are all free if you come and use our services. And so the typical amount of time for someone to go through cessation services would be anywhere from a month to ideally 3 months, because you'd want to, in the beginning, meet weekly for at least a half hour, 45 minutes to go over those behavioral techniques. And the patches come in 2-week time frames, and they have different levels of nicotine replacement therapy. So they start off stronger and then they taper down, so that by the end of either 4 or 8 weeks, depending on where you are, you might not even need any replacement therapy because the nicotine is pretty much out of your system. So we find that the most successful people in quitting nicotine, quitting vaping, come in and meet with us regularly for the first 4 weeks, once a week, and then after that, every other week, and they use nicotine replacement therapy, and they change their behaviors. That's what we work on each week. We help them identify triggers and situations that would cause them to want to go back to using their devices, and we help do that. And then also the accountability, knowing that you're going to go in and meet with someone to talk about a vaping cessation helps motivate someone to, not use if they're thinking about using. So so the benefits of nicotine replacement therapy and then having it for free at URI Health Services is a really great thing. And so I think a lot of people don't realize that they could do that. And so getting more people in, and there's never a better time to quit than now. There's no perfect time to quit. So to stop on by Health Services and go downstairs in Health Promotion and make an appointment, or you can email URI Health Promotion for more information about quitting.
Yeah, and all this information will be in the description as well if you want to copy and paste those links too.
Great.
And then just to end it off, do you mind going over that process a little bit more, like what those motivational interviews look like and those quitting steps specifically?
Absolutely. Yeah, so students can either walk in or make an appointment or email or call. The first appointment, they'll just fill out a form, just ask them about their nicotine use, like what devices are they using, how long have they been using it for, have they tried to quit in the past, those types of questions. And then you'll meet with the tobacco treatment specialist, which would be myself, and we'll just have a conversation about what their goals are. Like, why do they want to quit? Why do they think now is the right time? What do they need to be successful? And have they started quitting already? A lot of times students have tried a couple times on their own and they've tried to cut back. Other times they need to start from scratch. They're still using multiple times a day and they need help tapering off. So we'll meet the students where they're at, no matter what that is, and we'll help them along their journey. And the important thing is to remember that we are non-judgmental. So it's okay if we have relapses or if we were quit for a little while and then we went back to it, that we just know that it takes multiple times to do something, especially if you've been using something for years and that habit has been ingrained in you. It takes time to change that habit. Just like people who are trying to learn to lose weight for health or save money financially or even learning how to floss your teeth regularly, it takes time and practice. And the more you do it with support, the more successful you'll be. So anyone interested in quitting can come to us at Health Services and Health Promotion. We can make that appointment. And then my recommendation is to meet weekly for the first 4 weeks. And then after that, it depends on the person needs that again, or if we would meet every other week. And each meeting, we would just go over some behavioral techniques and even coping techniques and whatever else the person might need.
Yeah, and like you were saying before, there's no perfect time to quit. So yeah, just take that first step. It's time. Thank you so much for joining us today and for all this great information.
Thanks for having me. Thank you.
Before we wrap up, a quick reminder that all information shared in today's podcast is for informational and educational purposes only. Thank you for listening to another episode of Roadie Wellness. If you like what you heard today, tune in every Tuesday on all podcast platforms for more. If you want to stay up to date on events and healthcare tips, please follow us at URI Health Promotions on Instagram. And if you have any ideas for future podcast episodes or more social media content that you'd like to see, please feel free to DM us or email us. Until next time, take care and stay healthy.